sexual vital fluid. How many of you justify to see life force from the point of view of sexual vital fluid?
I justify, Ayya.
But it is a tricky relationship between sexual vital fluid and life force. Let us see how it is. Maharishi is impressing me every time when he comes out with something new, discovery of the scientific basis of matter and evolution. In the whole world, the seven sadhus are looked into by Siddha people and more so by Ayurvedic specialties. But even those two people, they don't give much details about the nature of the seventh Tadu, Sukra Tadu, as they call it. And Maharishi only calls it sexual vital fluid. And senior member Arulanandam is here, and he knows that many people in US are opposed to call this sexual vital fluid. They prefer to call it vital fluid than sexual vital fluid. Is it not, Arulanandam Ayya?
It is perfectly true, Ayya. True, doctor. Yeah, usually I also do it. Okay, thank you.
Right.
Yes, I agree, because most of the time when I go and take classes, they are like, oh, don't call it sexual fluid, it's offending. So we decided generally that it's called vital fluid and it's stored in the sexual gland. So
it is a paradox. Sex is not taken so seriously as it is taken in the Oriental countries or India. But in this way, it is the other way around. Maharishi calls it sexual vital fluid without any hesitation or difficulty. And more often, the suggestion is coming from US-based members that the sexual word should not be connected with this. Anyway, the Maharishi has valid reasons why he calls it sexual vital fluid. And as I was telling, he has, without a formal science-based education, he is able to contribute so much to the science. The absolute space is his monumental contribution. The energy particle, divine dust particle, life force particle, the concept of life force, the genetic center, the imprints, the sexual vital fluid, and magnetism, the imprints, so many things are new to the science with profound meaning in Vedadriyam. How he was able to connect such delicate, intricate, finer aspects of this science so clearly. The more you indulge in that, you are bewildered how Maharishi was able to identify these facts with no facilities from laboratory or any other imaging techniques in his time. And he really must be blessed to give so many fundamental things in a beautiful way. Let me see what sexual vital fluid is. It is the seventh dhatu. The food which we take is converted into juice, blood, muscle, fat, and bone, marrow.
Calcium, yeah, sir.
Huh?
Yeah, correct. Bone,
That's right.
marrow, and ultimately this one. Okay.
And the sexual vital fluid.
Yes, sir.
So, to think of life force coming out of the food is something different. Food giving energy is understood, but generating life force. And we think that the food gives the energy, but in reality, it is the life force that gives magnetism, which is the single unified force in Vedadriyan science. And the vital fluid is connected to both physical and sexual maturity. And body health is different from sexual health. And he connects both. Though they are two entities, he connects both in a special way, that it is the physical health which is more important than sexual health or reproductive health. The connection he makes to the sexual energy with the life force energy, it may appear to be simple, but it is not that simple. It is indirect. It is the contribution by the sexual vital fluid to the spinning system of the life force and related energies. When it spins in the body or in the cell, the spinning system generates an attractive force and repulsive force. And the presence of vital fluid is directly responsible for the attractive force of the spinning system of energies, whether it is within the cell or in the whole body, the biomagnetic genetic center and the spinning system of the energy. If the vital fluid is in good quantity or in surplus quantity, then the attractive force is more, and this overcomes the repulsive force, nullifies the resulting force, and attracts more life force particle into the spinning life force system. When more number of life force particles are there, the energy produced by the energy particles are proportionately more, and the body's biomagnetism depends upon the vital fluid amount that is available for the spinning system to decide. So it is not directly contributing to the biomagnetism, but it acts through the number of life force particles attracted and involved in the spinning life force system. And so it is somewhat not straightforward. It is not straightforward. You have to infer the indirect relationship between the sexual vital fluid and the energy that is created by the life force, namely the biomagnetism. And here, now I have enumerated some of the reasons connecting the sexual vital fluid and this thing. Here, according to Maharishi, the physical health takes more importance, primary importance than the sexual health. This we see often, that when the general health is affected, if there is a general problem, disease affecting the body, whole body, like systemic infections, and the infection may be viral or bacterial or protozoal or anything, and that when that is affected, the sexual activity is suspended. For the time being, the sexual activity is not there. The lady misses her periods. There is a period of amenorrhea before the onset of the regular cycles, which reflects on the general energy level of the body. Once the general energy level in the body improves, the sexual activity, the menstrual cycle is re-established then only. So this explains the relationship of it. In human beings, we observe that the growth of the testis or ovary are there in the first 1 or 2 years of the birth, and sexual maturity comes at the age of 10 to 13. And this delay in sexual function onset, signifying the maturity, with a pretty long decade interval, is due to the mechanism enunciated by Maharishi on the functioning of the sexual system and the physical system. Right from the birth, the energy available, namely the biomagnetism or the sexual vital fluid, is utilized mostly for the physical health, physical development. The number of cells reproduced, doubled or more depends on the availability of the sexual vital fluid. So up to maturity, more than a major percentage of the vital fluid is utilized for the somatic growth. And when this reaches a optimal level, from the age of maturity, the physical growth somewhat gets slowed down. The curve, instead of racing straight, it bends, becomes a plateau after the adolescence. And this also explains what Maharishi proposes to be the cause. And let me allow some time for you to raise some questions or some doubts about the points elaborated.
Doctor.
I have one question.
Yes.
Okay.
These days, lot of people take medications for diabetes or heart issues, blood pressure. So those medications actually causing a lot of reducing the libido, sexual appetite. So how do you, in that cases, how do the life force will work, and what are the way to you can improve or overcome that problem?
May I request you to repeat the question, please?
See, I think these days a lot of people taking medications to survive or maintain their disease, like heart disease, diabetes, high blood pressure. These things, when you go to the modern medicines, we have to take until you die or lifelong medication, right? These medications causing a lot of decreasing the sexual activity or libido, or there are many interferences already reported. So in those people,
do you mean to say the erection dysfunction or the direct action on the production of the gametes, sperm or ova? Action on the...
Yeah, that depends. Maybe it's age related because the defection in the sperm or egg is age related. But major problem is the dysfunction, erectile dysfunction, or the lack of interest, those kind of things.
This is only secondary to the balance of sexual vital fluid. And these metabolic disorders are affecting the whole body, and all the cells are involved. And any corrective maneuver involves the sexual vital fluid and affects the health. So in this way, it may be affecting, but the affection is not, we don't see that much of a direct affection unless there is a toxicity of the drugs or the toxicity of the system. The systemic energy is less in an individual by any other cause other than these metabolic disorders. It is secondary to the loss of the energy there, which is produced by life force, which again is directly proportional to the stock of the sexual vital fluid. In that way, it may be responsible, but it is the correction of the low volume of vital fluid, which is secondarily affecting the sexual behavior. As I said, in women, it is quite obvious where the sexual function is suspended. It is not functioning continuously as before. Okay.
Yeah, okay. Thank you.
Hello, Doctor Sir. One more question is, our Maharishi used to say, those who are indulging more in sexual activities, say, there is a connection between sexual activity and diabetes. I think you are aware, but I want more explanation on that. Those who are indulgent, or particularly those who are not having children, I also observed some at least over 10 couples. Those who are not having children, maybe they are indulging in the sexual activity more than other persons, and they are diabetic patients. Can you just explain in a medical angle?
The diabetes, being a metabolic disorder, affects the body from top to bottom.
Okay.
Almost all the cells. In medicine,
Okay.
the diabetes involves all the parts of the body. The nervous system is affected, the eyes are affected, the dentition.
Even brains are affected. Okay.
So it is like that from head to foot, everything, including the sexual function. The affection is one directly on the gonads and their function, the functional status of the testis and the ovary. The other is the direct health. The health reflects the status of diabetes. If the health is good, the energy production stability is good, the diabetes is not doing any serious involvement or compromises in the activities of the physical body. It is seen in the diabetics that first 10 years, they are not detected. Many are detected late after decade or so. Unless taking yourself to regular checkups, the presence of diabetes is usually noted when there is a decrease in the health and capabilities. Generally, tiredness, easy fatigability, retarded the immunity, they are more susceptible to infection. Like that, when recurrent infections are there, then the diabetes is susceptible. Otherwise, if it is not compromising the health status, diabetes, even though it is exists, it is not making any serious impact on the health of the individual. But once the action on the nervous system is more, then the erectile dysfunction or the hypo this thing sexual fitness is not there. Because of that, the outcome is affected. Whereas, as long as the effect is due to systemic, somatic health, the general health, they are corrected by correcting the diabetic level. The anti measures are giving good result. Such individuals, the hypoactivity, sexual inadequacy, decreased libido, erectile dysfunction, all may be getting corrected with the normalization of the blood sugar and the other metabolic functions. Whereas if the involvement is on the testis or ovary, then defect is difficult to correct, because if the seminal vesicles are affected, they don't hold the sperms and the semen correctly. There is some incompetence of the sphincter of the seminal vesicles, and there is leakage of the sperms in the urine. This is easily observed by the Siddha physicians. Our Trivandrum, whom you know, he was in Aliyar and
I know the doctor, Devangram. Okay, sir.
So
Okay.
he'll examine the urine and see the sperms there, and he'll say, poach, poach.
Oh, that is
all leaking through. So even though the production is normal, the leakage is there. The storage is not properly maintained, and the sperm production is not much because of the epididymitis or the production of the cells of the testis. Similarly, ovulation may be impaired by the involvement of the ovaries. And these are primary, and this somatic health affected, causing diabetes, and diabetes in turn affecting the sexual function is more common but correctable. A strict control of the blood sugar, weight, and other activity, all those things, anti-diabetic measures, really give good results.
Okay, doctor. Completed?
Right.
Dr. Anand Kumar, can you just give your own explanation?
Yes, Ayya.
Anand, please come. Yes.
Yeah, Anand Kumar, sir.
Ayya,
Urology. See, he is concerned with the urology, the part affected by diabetes. So he will be able to give more information. Thanks for calling him.
Yeah, already he has done research and presented so many papers on Kaya Kalpa and all that. So
Yes.
I think we can give, Okay, Dr. Ananda.
thank you, Ayya. How I take this sexual vital fluid is in the form of prana. It's like a pranic energy. That is, I just want to make one sentence. But coming to the Aruranandam Ayya's question, few changes are increased sexual activity will not result in diabetes. So there are some facts we should understand. Number one, increased sexual activity will not result in diabetes. Number two, couples who don't have children doesn't mean they are doing increased or decreased sexual activity. Sexual activity has nothing to do with the parenthood. That is, those are the two main things. Other than this, I agree with how Dr. Abhidanath Ayya has explained. So when the diabetes affects the neurology and vascular anatomy of from head to toe, it indirectly affects the vascular supply and also the nervous supply to the organs like, for example, erection. And that can result in erectile dysfunction, that can result in even lack of libido. Lack of libido can be explained even outside diabetes as a low pranic level, and these can cause erectile and ejaculatory dysfunction, lack of interest in having sex. The same thing can happen in a woman also. If she has low pranic energy, the interest to have sex libido and ability to have a successful long prolonged sex will go down. If a woman or a man has got low sexual vital fluid or pranic energy level, obviously the sexual vital fluid and vitality will be diverted in repairing that particular problem. Say, for example, chest infection or a big leg ulcer, something like that. So during that acute infection episode, again, he or she may not be able to have an interest in sex or perform a good sexual activity. In a woman, it easily demonstrate, as Rabindranath Ayya said, as amenorrhea period. While in a man, he may not be able to produce any ejaculation, that he will see only during the masturbation or during the sexual activity procedures.
Communication. I think. Can continue, sir. Continue, doctor.
Yeah,
Continue, sir.
that is the main thing, Ayya. And apart from that, as we previously discussed in other question also, there are a lot of medications which also can cause side effects of problems in erection and ejaculation. But apart from that, that disease itself can cause a low sexual vitality in the body. That itself can cause a good amount of erectile and ejaculatory dysfunction. Vargola, madam.
Madam. Any other question?
What is the we talk about the sexual vital fluid. What is the difference between semen, sperm, and sexual vital fluid? How they are linked together?
Very common doubt arises like this, and let me explain. The male reproductive system is producing sperms, and the matured sperms come via the convoluted tubules to the.
It's called epididymis.
Yeah, epididymis is one thing, and it ends in the seminal vesicles. In the seminal vesicles, it is stored, and when the appropriate stimulus comes, it is ejaculated, it is emptied. And similar system is not working in the female. The female produces eggs, ovum, and they are released periodically from the right and left ovaries alternatively one time per month, per cycle. And the sperm, the semen equivalent is not there in the female, and there is no storage part for the ovum or egg. It is released then and there intra-abdominally, which is picked up by the fimbria and gets into the conducting system, the tubules of the uterus. And that is the difference between the two. And the egg, once it is discharged into the abdomen, picked up by the ovarian tube, fimbria and all, it reaches either the uterus or stays somewhere in the tubal level. And if it is meeting the sperm there and gets fertilized, then the pregnancy continues. With the fertilization of the egg, the pregnancy continues. Conception is there and it continues. If it is not there, the levels of the estrogen progesterone balances and denudes the endometrium, which comes as a period, the menstrual cycle onset and the oval. This prepares the lady for the fresh cycle, and chances for pregnancy are more with repeated menstrual cycles than without it. With amenorrhea, you have less chance of fertilization or conception. So this is the two male and female systems. And regarding your question, the sexually vital sperms are produced in the testicular structure, and it passes through the epididymis to this thing. In the seminal vesicles, various secretions of the dozen glands or more associated with this. Their secretions also come and stay in the seminal vesicles, and they add volume to this thing. And once the seminal vesicles are full, just like any other bladder, when it becomes full, there is a tendency to empty it. So just like urinary bladder, this seminal vesicles also, when they are full, they stimulus to empty it. The sexual thoughts or the indulgence starts, which promotes emptying, either in the by means of a dream or some other mechanisms. So the sperms are the first one. Then the various secretions in this thing, prostate and the other glands around there, they also secrete, and their secretions add. A lot of mucus is also secreted. If with storage, the contents of the seminal vesicles, you can call it semen, it gets concentrated. More and more water content is reabsorbed into the system, and the secretions become more viscid. The sperm becomes more thick, and when it is thick, it takes longer time to ejaculate. The premature ejaculation is less common when the semen is thick, and it is more common premature ejaculation when there is a liquefaction of the semen, when it is watery. In Tamil we call it neerthu podal. So when it is quite watery, with little stimulus, it gets ejected. That is the explanation for sperm. Semen and the release, the thickness of the semen, and when it is watery, the number of sperms there are much less, more water content. Secretions of the glands around, they are more, and if it is not emptied, this water content is what secretions become more viscid. The H2O water is reabsorbed and accommodating more number of sperms and the other solid secretions like mucus and other things. They add to the quality, and Ananda, being a specialist in this, he'll be able to give more.
There's one more thing. Was the part of the question, right? The sexual vital fluid, how it is linked with this, the semen, basically. How the sexual vital fluid is injected in the. Yeah.
It is the sexual vital fluid is the seventh dhatu, and just like the other dhadus, these are all the seven dhadus are in the physical body, and they are in a spinning system. And when they spin, you get fractional differentiation of the layers in which they concentrate. So the outer layer of the spinning system of the physical body is represented by the juice. The next layer is by the blood. In between you get the lymph. Then next to blood you get the muscle protein, the the cells of the muscle, the sarcoplasm. So that is the next generation. Then you get the fat being separated from the muscle and separates the bony layer and the muscle layer. In between the two, you get the deposition of the fat. And this allows the attachment of muscles in focal areas, in the origin of the muscle, at the insertion of the muscle. In these two places, they get attached to the bone. But in the rest of the areas, they are protected by the presence of fat there, which allows free movement of the muscle over the bone. Thereby, locomotion is possible. And next comes the bone marrow, where the blood elements, the lymph elements, and they are produced. White cells and the red cells are produced. The platelets and other organelles of the blood system are produced there, and that is that goes into the blood. Whereas beyond, a lot of immuno agents are also produced. Immunoglobulins are also presented in the marrow, and that accounts for the the immunity of the body. And when it comes to the secretions of the bone marrow, it is the sexual vital fluid. If you look into the nature of the other six sadhus, juice is quite light, watery, and stays out. Next comes the blood, and still thicker is the muscle, and the heavier than the muscle is the fat. The bone is obviously the strongest in the body, but within that strong bone, within its marrow, you get a jelly-like the bone marrow. And here, the increasing order of the density of the sadhus, namely juice, blood, muscle, oil, bone, all are increasing. Here it is becoming lighter again. It becomes a jelly-like, and that is bone marrow. And what comes out of the bone marrow is the sexual vital fluid. Is something special in that it has no physical form. It is an energy that is thoroughly permeable to the body, and it is present universally within the body in almost every corner of the body. In all tissues, it is penetrating into all tissues, and it nourishes. It is the source of energy for the cytoplasm, the cell organelles, and everything. If there is damage to the cell, they are reconstructed with the energy of the sexual vital fluid. They grow, they mature because of the sexual vital fluid, and they divide to two daughter cells. So this process is done. The physical growth and the maturity of the cells And the matured cells behave like a sexual field where it divides into two daughter cells. So, in addition to it, if these are all functions in the physical body, and if the vital fluid is there in surplus, then it acts on the sperms and the ovumes. They are suspended in the medium of sexual vital fluid. I can just give an example like Akash. In Akash, all the other 5, this thing, the
other senses. Fire.
yes, just like water, fire, solid water, fire, and air. All these things are present. Panchabhutas. These Panchabhutas are all present, and that takes over. Whereas the sexual maturity part of it comes when they act on the ovaries and the testes to produce the gametes, namely ovum and sperm. And they are suspended in the spinning system of the 7 tadus. The highest concentration of the vital fluid is present around the center of the genetic center. And interestingly, our ovaries and testes are present in the region, in the vicinity of the genetic center. So, when the egg is released from the ovary, it is present in the medium of sexual vital fluid. When there is ejaculation, the field where the seminal vesicles are there, within the seminal vesicles and outside the area of the seminal vesicles, the concentration of the vital fluid is more than in the periphery because of the simple nature of the spinning system. So it becomes important. The sperms are released into the female reproductive tract, into the vagina. Whereas from vagina, they have to travel a long way into the cervix and into the uterus, the endometrium, and reach the ovum. If it is in the tube, then they go to the tube. The sperms, they all go and attack, find a place to catch hold of the ovum. And each sperm makes a dent to its part, and successively, there is only one egg, but millions of sperms. And all the sperms, they attempt to get attached to the sperm. So once they get attached, their head is lost. The enzyme present in the head is also lost. So they become difficult to enter into this thing. If a series of attempt is made, just like the enemy's army trying to enter into the fort, they keeps on making the attempt, and once they able to break through the fort wall, the entire army goes into it through that. Whereas in a egg, this is not possible. When the single sperm enters into the ovary, mixes with the cytoplasm of the ovary, then it secretes a substance which creates a hardened cell wall of it, which bars the entry of any other second sperm. So this is the funny behavior of the nature, protective behavior, which otherwise fertilization and proper growth of the fertilized egg to become a baby. Cannot be there. So this is nature's way to prevent that and promote the conception and the growth of the fetus. So this is the thing which lies behind the fertilization and the conception and pregnancy. The sexual vital fluid has an important role. Once the semen is ejected from the seminal vesicles, they don't have a contact with the physical body, and so they depend on the sexual vital fluid media in which the sperms are lodged. So if the sexual vital fluid is not adequate or congenial for the to give support to the sperm to its passage towards the ovum, then the sterility results. The progress is difficult. Without the support of the vital fluid, the sperm becomes weak. So most of the cases of sterility with normal seminal characteristics or the female reproductive tract conditions, when both are normal, when the sperm count is normal, the ejaculation is normal, the intercourse is normal, the fertilization depends on the sexual vital fluid. That I can tell you. Okay?
Wonderful, Ayya. So it feels like the sexual vital fluid is kind of a magnetic domain, or the kind of a full intensified dust particles kind of a stuff, right? That's what it feels like, right?
Yes. Intensified, just like the space, Akash, giving way for the rest of the Panchabhutas to stay. The field of sexual vital fluid helps to the sperms to remain healthy, motile, virulent, viable, to make entry into the uterus and proceed to the ovum present there. This is an important aspect which is not understood in the science. They only say it is normal anatomy and physiology, but failure of ovulation. That is fertilization. Okay?
Yeah, thanks, Ayya. Very wonderful.
Ayya, you have given very great explanation about the sexual vital fluid, and last week we had a very good discussion about genetic center. So this seventh Tadu's sexual vital fluid, Maharishi is calling as Jiva Vittu Kudambu, which is essential for living, which we can say it is compared with the absolute space, Jiva Vittu Kudambu. Without that, there is no living being. So that seventh Tadu, sexual vital fluid, Jiva Vittu Kudambu, will become into ojas. This is into getting into another formation when it is going upward, and it is going towards downward. When it reaches to the particular organ, then it is changing into the fluid, sexual vital fluid, or for the fertilization it is using for. But going towards upward, it is becoming into different formation, the same sexual vital fluid, and getting changed into the, for the minute.
Yes, it is right. Okay.
Yeah, so in that case,
this we see in Kayakalpa, where we do Ashwini Mudra, the genetic center area is represented by the Muladaram or the genetic center. Both are same. And in this area, the concentration of the spinning system contains heavier objects, high specific gravity objects, and the SVF has the maximum specific gravity, so it is present there. And for fertilization to take place, it is required. And if it is overindulgence is there, it exhausts the contents, surplus contents present in the region of the genetic center or the place around the seminal vesicles. So there it is, when it comes down, it results in difficulty in fertilization, the migration of the sperms towards the ovum, and this difficult.
So there is a characterization difference between it is going towards attractive force and the repulsive force. It acts in different way, the same sexual vital fluid towards attractive.
The attractive repulsive forces are in general, they decide the number of life force particles, Akash particles in the life force. The life force particles are present within the body, in the field of biomagnetism, or in the field of universal magnetism. Everywhere it is present. And they either become Panchabhutas or Sabdatadus according to the opportunity given to particular life force particle.
So when it reaches to certain chemical content, when it reaches with the consciousness, when it reaches to certain chemical content, so we definitely call it as plasma. Right?
And the plasma is a state which is having the commonality of gas, liquid, and solid. And more about plasma. Plasma is a new science. It has not yet come into the textbooks, I suppose, if I am correct. And
even the sexual vital fluid also can be with the solid liquid gas, as just we know.
Yeah. I said that it is a formless energy, and it is thoroughly permeable, just like the absolute space, just like magnetism. These are all subatomic in nature, and they are present all over the body. There is no place which is debarred for the magnetism and the energy particles or the life force particles to exist. They are all there. The plasma has a similar criteria, and those things I think Ravi Prakash will be explaining in the next session. So until then, you people may wait, I suppose.
Yeah, makes sense, Ayya. I think we should wait. I just want to go back to a common thing, just for making sure I got the right inference. We talked about Saptatadus, and we know the last one is sexual vital fluid, and we realize and understand that sexual vital fluid is present in man and woman. And during the course of the discussion, you also mentioned that men have semen. But would you be able to tell us, is there at least for understanding's sake, a good counterpart to semen in females? I know we have sperm ovum. I'm talking in terms of semen, because this is very highly confused in the messaging part of Vedatria.
See, females, Maharishi gives a special status for them. They are not equal to men. They are not superior to men or inferior to men, but they are special. He manages to use this special word special and gives them a special status. And similarly, the female reproductive system is not in the common area available for investigation, intensification, unless it happens to be a hospital. The gynecology, obstetrics specialty, we don't deal with it in open level. So there is some amount of paucity of knowledge, exposure to the men folk. And even among the women folk, unless they study, they become doctors, they don't have a possibility of understanding everything in full. So the female has a more special qualities which makes them feminine, more a mother than a lady simply. So this difference comes out of the special features present in the lady, and that helps them, that gives them the qualities of becoming a mother, nursing the child, ready to undergo the sufferings for the sake of the growing child. She puts the child before her and undergoes, tolerates, and even enjoys all the sufferings. And here the divinity comes in, and that is the special nature of the women. And that is where it is connected with the vital fluid, sexual vital fluid, and the nature, its nature, a plasma. It is a subatomic area, indefinite area, whether it is solid, liquid, or gas. It is an entity of all. And I only suggested to our plasma scientists whether we can call sexual vital fluid as plasma, because we don't have much details about sexual vital fluid. Those who know about Sukratadu, they only know about the egg from the female and the semen from the male, and which contains the sperms. So the nature of the women and the reproductive system and its contribution more by the subatomic nature of the finer aspects of the human breed, it makes it special. Okay, once we have a more knowledge about the plasma, we will be able to have more discussion on it.
Okay, India. Thank you. God.
Arulanandamaya.
Ayya, he is not here. He left, I guess.
So if there are any questions, we will continue otherwise. What do you say, people?
Ayya, I have a question. Can you please tell me, like, where the sexual vital fluid is present before maturity, and what's the mixture of it?
The very nice question, appreciated. The sexual vital fluid is produced in the bone marrow. It is not produced in the ovary or in the testis. So, whether the individual is mature or not, and has not attained maturity, it is produced by the food which we intake it, and it is present, and it is responsible for the somatic growth, physical body growth, differentiation into different type of cells, the 7 tadus. It is all responsible for this thing. This is an energy. It is not stored anywhere, but because of its high specific gravity, it gravitates towards the center of the spinning system, which is around the genetic center. When it is accumulating in the region of the genetic center and the quantity of the vital fluid crosses a critical limit, then the somatic growth is flattening, and the consumption of vital fluid for physical growth is not much. Requirement is coming down, and then the surplus amount increases, and that produces a high voltage of magnetism, and this high voltage makes the dormant ovaries and the testicles to function, which is observed as a menarche or maturity in both sex. So that is the way the vital fluid is present in the body, unconnected with the reproductive system, and before the maturity. Pre-pubertal days, it is present like this, only like a tadu function, only the nurturing function of the body cells and their multiplication is being looked after. Of course, the immunity and repair and reproduction of the somatic cells all being performed by the vital fluid, sexual vital fluid. Here it is not doing the sexual function, so you may be justified in calling vital fluid only. Okay.
Okay, thanks. Got it. So you're saying that vital fluid is present in the bone marrow before maturity, and it is responsible for the growth. And then after maturity.
1 minute. It is produced from the bone marrow. It is not present in the marrow.
Yeah,
it is secreted.
Uh-huh. Yes, sir.
It is not stored in the marrow also.
Okay, so it is secreted in the bone marrow and it is responsible for the growth. And then you're saying that it comes down to the Mooladhara. So you're saying how it comes down to the Mooladhara?
Naturally, it is a spinning system. If you spin a system which contains the various sizes of solids, says mud and the finer sands and the small fragments of stone, solid masses. If you spin that, the heavier particles will come to the center first. Like that, this being the heavier one comes to the center first and occupies layer by layer. The first layer is the vital fluid, the second layer is the bone marrow, the third is the bone, and the fourth is the fat, fifth is the muscle, sixth is the blood, seventh is the juice.
Okay.
We not only have panchagoshas in the body, we have this sabdatadu layers are also present. That's why in anatomy, when we dissect out, initially we dissect through the subcutaneous, below the skin. It is the subcutaneous tissue, which is not any specific tissue. Below that is the vessel, circulatory system, blood vessels, arteries, veins, capillaries, and the finer interstitial spaces. And then you have the place of the muscles, the sarcomeres and the groups of it, muscles, bundles of muscle cells, and then you have the fatty layer there and the bony structure, the marrow, and within that marrow, the vital fluid is produced. Okay.
Okay.
Now, shall I invite Ashwin Shah to contribute something?
Namaskar, everybody.
Yes.
Doctor, I'm not expert in anatomy or physiology, so I don't know how much I can contribute. But and I missed a few minutes of your lecture because I had some buddy at home, so I had to attend to them. And that's why I was going to request Vijay Lakshmi Ben to find out when your lecture, today's lecture will be posted so I can listen to it. But when I heard the later part of the lecture, it sounded very, very interesting to me. And when you talk about plasma, because that's a subject of my interest also, me being coming from the physics world, So hopefully when we talk about plasma and all that, and once I digest everything from your lecture, I probably will have few thoughts. I don't know. I will try my best. But for today, I'll have to pass it.
Okay, sir. Okay.
Thank you, sir.
Okay. Yes, Prasad.
Sir,
Please.
probably Vijay Lakshmi might be aware. There is a master's refresher cum training course happening last Saturday, Sunday, and this Saturday from 10 o'clock. I think some of the people would have been gone there. Hopefully in later sessions, you could probably come and address that. And I will probably request Murli also. So it is just a master's refresher course. They're doing it annually. So there were 2 sessions, and today one is happening from 10 o'clock this morning. So as appropriate, I consider, it will be good that if you can just address some key topics.
Tarun will look into the interest.
Yeah, Tarun, I think Tarun and Vijay Lakshmi are aware. Probably at some point they can look into it. Thank you.
Yes. Okay, Ravi Prakash, you give an introduction to your next class.
So actually, next class, our daylight saving time ends.
Whichever time you say.
Yeah, Indian Standard Time will be 7:30. Our time will be from 10 a.m., not from 9 a.m. Prasadaya. So I think that should be okay, right? From 10 a.m.
Okay for you. For us, it is okay. We are
we are not going to change the Indian time since you are available in that time. So we don't want to change any other time.
Naresh?
I had the question and you answered it very well, So it gave more clarification with the connection between sexual vital fluid, sperm and semen. That was really wonderful.
Right. Thank you.
Doctor, I have just one question.
Yes.
So, what is parallel to sexual vital fluid in the universal magnetism?
The universal magnetism, you see the birth of new spinning systems, new stars appearing, birth of a new star. It may be requiring the vital fluid, and it is present in the universal field also. If it is spinning, locally, wherever there is a spin, there is accumulation of this heavyweight vital fluid in the center of the spin, and there it can evolve. So equivalent to the sexual vital fluid will be present in the universal field, but in pockets wherever there is the spinning system. The spinning system facilitates intensification of the energy and formation of orbital layers in the spinning system. So this can differentiate to the Panchagoshas, Panchabhutas, and Sabdatadus, like that. So when these things are present, it's possible to have a human being, it is possible to have a planet form, all those things are possible. When it is not spinning, it is not possible to have this evolutionary stepping up stones from one Thadu to the other Thadu. Okay?
So the evolutionary, basically,
yes,
part of the nature is responsible, or it is mainly due to the spinning system that is caused by the self-compressive force, which is the result of the self-compressive force.
Yes.
If there is no self-compressive force, there won't be any spinning system either.
Yeah. And if there is no this thing, quivering and this thing, that vibratory nature is not there in the spinning system, evolution is also not possible.
True.
The quivering and kinematic vibrations of the energy in the self-compressive system makes the possibility of a different size of energy particles. When it is in the peak of the compression, you get the smaller particles. When it is in the
I think we lost him.
Ayya got muted for phone. MVR.
That is helping the making the possibility of evolution.
Yeah, but the intensity of self-compressive force, isn't it the same everywhere in the space?
It is varying, and so the nature and density of the stars, space of the stars vary. The planets surrounding the stars also vary. And it gives a profound plethora of presentations, possibilities in the universe.
True, but what causes it to vary? The self-compressive force is the inherent nature of everything.
Yes.
If
there is a vast area of absolute space, number of light years distance, then the possibility of this become more intense and spinning in a larger area makes it a larger spinning system, makes the possibility of a huge big star, sun there to appear. And when it is not there, it is the area available is small, it becomes smaller. Beyond the influence of Earth, we have the lighter ones in the space, and they have a larger volume. The planets of our sun, solar system. The Mercury is the hardest and the smallest. And the Neptune and the Uranus are the biggest and more amorphous. And the solidness is less in them. So the same thing is possible in the space also. Fortunately for us, the universal rules are same, whether it is in a micro system or in the macro systems. The rules are same. Karunya,
Yeah, all on that.
any questions from you? Any comments from you?
No questions. So, but one thing that I wanted to say is like while I'm trying to understand and master the Brownian motion, which probably enthusiasts of physics and mathematics would understand. I am a little bit struggling on how that impacts or how the life force works on it. But now I will have to look in the angle of how the vital fluid influences the life force along with the creation of the life force on the bone marrow to the sexual vital fluid and how it motions itself into it in a Brownian motion form. But the Brownian motion form, they usually say it's random, but this one is not random. There is a specific pattern in which it does, and it expands and shrinks itself. So I was just listening to that and trying to think while I was coding my model.
Brownian moment, if I can intervene.
Yeah, sure.
The moment is there where there is no spinning system, where there is a long movement. When the a zone of movement is limited, Brownian moment is possible. The one particle moving in one direction is prevented by the other surrounding one, so it comes back. The to and fro movement is the Brownian moment. Is it so?
That's Brownian motion, yeah, exactly. But then I'm looking at geometric Brownian motion, where it works on the multidimensional hemisphere.
Brownian moment is always limited. For it to become mega, big event is not possible. The spin intervenes and takes over.
That's where my challenge is right now. I'm working on how to introduce the spinning moment on a random particle moving.
The smaller particles, smaller energy particles go faster around the larger slow particles. And that makes it possible to have a coupled movement. And the movement of particles in pairs and groups of pairs, and which builds up to form a cell or a multitude of cells, namely the living being.
I think Taruni is heading in the right direction of his thinking, in the sense that we in today's scientific world think that Brownian motion is random. As per my thinking, there's nothing random in nature. Everything follows a definite law, and when we don't understand that law, or when the law is being executed multiple times, then we perceive that phenomena as random. So the way Tarun is thinking to tie it up with the spinning system, because the spinning system has certain definite laws as per the spiritual science that Swamiji has laid out, So it's perfectly makes sense to me to head in that direction, which is a very interesting topic.
It's exactly what I was trying to do, because general conception, as Rabindranath Ayya said, brought in motion is random, but there is not I'm trying to introduce a non-randomness with the spinning force in effect.
When there is synchronization in the Brownian moment, when there is an extension of the Brownian moment, then the spinning moment starts in. And of course, everything is not so simple to put it in words. And we have the entity of the divinity where nothing is known to us. We make assumptions about the divinity. So let us continue to manage in the same way until next class.
Exactly, yeah. That clearly puts in where the assumption is taking part, because one is a model, mathematical model, physically accepted model. One is this assumption model coming in. There is one you said where there is a spinning motion coming into picture. That's where it's taking a long time. Thinking process is longer than implementation. So I'm just trying to get those equations in place. Hopefully I'll get a breakthrough soon.
Wish you get a breakthrough. Maharishi will be happy.
Yeah, thank you. Yeah,
Ravi Prakash Ayya is reserving his energy for the next class, I suppose.
Thank you, Ayya. We'll discuss Ayya shortly. Ayya.
Can I do one question?
Ravi Prakash Ayya is going to talk.
Oh, okay.
Are we going to continue next week? Ayya, it's 10:35.
He is going to answer. Let us hear to Ravi Prakash.
Okay,
Welcome, sir.
Yes, sir. Ayya. Yeah, we'll meet by next week and discuss in more elaborative details. Ayya.
Okay. About sexual vital fluid, its nature, whether it confines to the plasma nature or this thing. Our Ashwin Shah is keen to listen to you with his own ideas.
Yes, I am.
Yeah, we will do that jointly. Yeah.
Okay, Ananda, shall we close for the day?
Sorry, it's not possible to ask two questions to Dr. Ravindra.
Julia, I don't follow what you are telling. It is
Namaste. Thank you for your dedication and knowledge. Can I ask two questions?
Yes, please.
Okay, first is one simple, because I understood that the energy is only one, and the vital fluid and sexual vital fluid is only one.
Yes.
And then if the body has the down energy or weakness, whatever, then of course vital fluid or sexual vital energy is going to the store and some dysfunction problem. But my question is, in the case of menopause, what is the reason, the cause when come is because of lack of energy, lack of vital energy, come menopause? That is one question. And second is, I think, I understood that this sukra is the seventh dhatu, is the last dhatu coming from, for example, one drop of sperm so much amount of food. And
Yes.
then food must to supply every dhatu, and then the last is sukra. And when some problem of lack or one problem of disease, there you told there can be lack of libido, lack of interest in of sexual function. But I think this vital energy, sexual vital energy, is related with the mind and intellect. And
Yes.
then I think some Rishi Swami are not interested in has lack of interest in of sexual energy, sexual function, but because this energy is used for other purpose. And then I think that I want to ask, the lack of interest in on sex, on libido, means always lack down the energy of the body is down, is weakness, or it's because mind direct the interest in other way.
And that's what it is, converting into other form. Even the same sexual fluid will be converted into other form through Kaya Kalpa and other practices all Siddha yogis follow to make into different form. It makes more mental activities and more stronger.
Yes, and then I think lack
The
of
quantum amount of energy, quantity of energy involved in the mental process is less. The physical energy, the physical body's activities, it is more than the psychic energy. And in the sexual energy, it is still more. You can put them in order like that. First, the mental activities. Second, the physical activities. Third, the sexual activities. And even in male, there is a menopause-like symptoms where there is a loss of libido and interest in the sexual activity is coming down, where they are not indulging in sex. Similarly, in women, when the energy, vital energy is less, it is not expelling the eggs out of the ovary. It is not enough to burst out, liberate the egg. And that's this thing. And similarly, they become sterile when it is not adequate for a long time. So these are levels of energy and manifestation of the various states of energy that are available.
Okay. Yes. And then menopause comes only because a lack of energy. Energy come down, no?
Yes.
That okay.
We will continue it in the next class.
Okay. Thank you.
Rajmohan Rajmohan, make yourself audible.
Raja Mohan, Ayya, you are in mute. Ayya.
Yes, sir.
Today, very nicely explained in detail. It was a very wonderful session, actually. The sexual vital fluid, or called vital fluid, is becoming a plasma, and from that all life force particles are suspended on this. Very nicely explained. And the genetic system, sexual system also explained in details. Very nice, doctor. I'm waiting for how plasma is very similar to absolute space. So from the absolute space, we are telling that dust particles are produced based on the self-compressive pressure force and kinematic theory. Then the association of given dust particles becomes life force particles. So the SVF, or vital fluid, is a plasma, are very similar to absolute space, where it attracts life force particles and divine dust particles.
Congratulations, you are tuned with the discussion. If you allow me, I will put it as absolute space. Next comes the magnetism. Next comes the energy particles.
Right, correct.
Put together, you get the plasma. And then you get the life force particles of Akash particles and Panchabhutas, like that.
Okay. So this understanding is very, very clear, actually.
Yes.
Okay, sir. Okay, doctor.
Vijay Lakshmi, it is 9:15.
Yes, SMVR. So we'll conclude.
All